Here at Heart and Health, we've been asked many times about heart screening. So we decided to make this video to show you just what is entailed at a heart screening. This is a heart screening we just recently performed at Norwood Elementary School in the Comstock School District in Port Jeff Station. Step 1, when you arrive, you're greeted by our staff, where a brief medical history is taken. Step 2, we test your blood pressure and your oxygen sensor is placed on your finger. Your heart rate is also taken. These tests are totally painless. And then it's off to step 3. An EKG is taken of your heart and explained to you by our staff as the test proceeds. Step 4. All your information is gathered and presented and explained to you, should you have any questions. Step 5, where you'll meet with our board-certified cardiologist, Dr. David Cavestein. Dr. David Cavestein will explain your results and answer any questions you might have. He will also inform you if you have any risk factors you might need to know about. That's it, and you're done. Listen to what other people have to say about the heart screening. How hard was the heart screening?
Oh, the screening was easy. Very, very simple. Nobody had to get undressed. It's not painful. No blood drawing. I think that's a lot of people question about that, that they're fearful of coming because they think that it's going to be a difficult procedure. It was very, very painless. I think that more people should come and take advantage of it.
How long does the test usually take? I mean, was it you were there all day, or how quick were you pretty much in and out?
I think I've only been here about 15 minutes, and quick and easy, in and out in a short amount of time. And everybody was very, very helpful, very, very kind, and they make you feel at ease. And with the screening itself, with all the electronic equipment, there's no pain, right? No pain. Simple stuff. You just have to give them your arm, for your blood pressure. EKG, done very easily. You don't have to take off your clothes. They slide the leads underneath your clothing. Very simple, very easy. And would you recommend that other people get this free heart screening? Oh yes, absolutely. I think it's a great service that we're doing here, and I really think other people should come and take advantage of this because it's a great thing. And how long have you been school nurse here at Norwood? I've been here 15 years. 15 years. So 15 years. You have a long track record. Yes, I have a long track record of being here. But it's great things that we're doing here. As far as like medical costs are concerned, these free programs and everything, do you think people should be definitely taking advantage of it? Oh, absolutely take advantage of it because the program is for free. So people should really come in and take advantage of these things, because there's no cost. And the skyrocketing medical costs that are going on right now, sometimes a screening like this would cost anywhere from $300 to $400. Yes. And you know what? Just finding out things early. If you're nervous, you can come with a buddy. There's other people here. Come with a friend, and it'll make it much easier for you. Yeah, we've been seeing the buddy system. They've been coming down 2x2s. It's almost like Noah's Ark over here. Yes, that's it. The buddy system definitely works. I came with buddies myself. And we've not only seen but the teachers, but staff and other employees of the school coming down together and pairing up. Yes. So that seems to be a good thing. So whatever department you're in, you're teaming with somebody else. Whatever will get you here. That's what we like. Whatever will get you here. All right. Well, I want to thank you for your time and thank you for experiencing the free heart screening done by Heart and Health here for the Comstock School District. Oh, thank you for having me. So, Joe, what do you think about this free screening thing that Dr. Cavestein's doing?
I think it's wonderful. A year ago, I came to the free screening, and the only reason I did was because I felt kind of bad that the doctor was giving up his time to be here, and I wanted to make sure that I'm one more person going, and everything was normal at when I came to the screening, except for my family history. And after discussing it with the doctor, and the fact that coronary artery disease runs in my family, back to my great-grandfather, my brothers, my grandfather. So he said to come in for a stress test, and it was as a result of the stress test that they discovered I had a blockage, and I had some stents put in, and it turned out that the blockage was 85%. That main artery, coronary artery, was blocked 85%. I didn't have a clue. I had no palpitations, no shortness of breath, no chest pains, nothing. And the only thing that really, the reason I'm still sitting here is because it started with this, and then Dr. Cavestein, he wouldn't let go of it. The insurance company didn't want to send me for a test. He just kept hammering away because he said, I have to find out what's going on inside there, and thank God he did. And so I'm glad to see we have a decent turnout today of our teachers and staff because the price is right. You're coming in, you're meeting with a specialist, you're getting some initial testing done, but more importantly, he's talking to you about your history. And that's really what triggered it for me. Today, 2 of my sons came here, not because they have any heart issues at this point, but there's a history. And they want to get a baseline, make sure things are okay for them. So I think it's fantastic. I think Dr. Cavestein, he's always going to be a hero in my life. He saved my life. So anything I could ever do to help him or have other people go to him, you're putting yourself in outstanding hands if you go see him.
Otherwise, we might have been interviewing a new superintendent of schools at council.
I got to tell you, all it takes is a tiny bit of that plaque breaking off and clogging up that little 15%, and you have 5 minutes to get to the hospital. That's the artery they call the widowmaker, because you have no time. Once it clogs all the way, game over.
And would you recommend screenings to other people?
Absolutely. I think it just makes sense today because it's non-invasive. You don't have to give a lot of time to it. And even the stress test that you go later on, he does a very thorough Doppler on all of your arteries and veins to see that they're clear. It's very thorough. Then you can leave at least knowing, I'm a 1951 car. Chances are something could be wearing out at this point. So I have to go see somebody who understands it, and he's the guy.
And at the last screening, we had people as young as their 20s coming in and getting screened because early detection is the first thing.
And that's the thing, it's not, age is not, my brothers had heart attacks in their 30s, and they were both in good shape and all the rest of it. So genes and genetics play a big role in that, and you can't fight that. But what you can do, as they say, is detect it early enough, and they did just early enough in me that I didn't have the heart attack first, and then you're dealing with damage to the heart besides, the issues that brought you there in the first place. So this was great, and then he also sent me for cardiotherapy afterwards, and it was wonderful, and I feel a whole lot better than I felt. But I can go to put my head on the pillow at night, not worried about it.
Yeah. Joe, I want to thank you for your time.
My pleasure, Larry.
Good words.
Good seeing you.